Good morning or good afternoon to all of you who are joining us today for the patient panel being put on by the MSA Coalition during this MSA Awareness Month. And before we start, I need to read a disclaimer for us all. This education session is not intended for the purpose of providing medical advice. All information, content, and materials is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. The information supplied through webinars or on our webpage or by any representative or agent of the MSA Coalition, whether by telephone, email, letter, or other form of communication, is for informational purposes only and does not constitute medical, legal, or other professional advice. And that's our disclaimer. And now we'll move forward today. We happen to have 3 patients with us today. A fourth one was unable to make it, and so we're going to be relying on the expertise and experience of 3 MSA patients. I'm going to introduce each one of them briefly, and I don't know how you see them on your screen, but I see them on my screen with the first one I'll introduce, who is Kate Alaverius. And Kate Alaverius was experiencing symptoms of MSA as a restaurant owner, and she literally began falling down on the job, which got her into a pathway where ultimately she was diagnosed multiple times, and those multiple diagnoses led to multiple system atrophy. She has served in a number of executive capacities in the public, private, and nonprofit sector. And she's also run for almost two decades, a 501c3 organization that she founded to help educate and address the developmental needs of youth. She is attracted to the work of the MSA Coalition, would like to help the coalition in any way possible, and she's dedicated to eradicating MSA and finding the biomarkers that contribute to an understanding of the disease process. Okay, welcome, Kate. Thank you for joining us and providing your time today.
Thank you very much.
You're very welcome. Okay, next on the list is John Urban. John is a 64-year-old patient with MSAC now for 5 years, since 2019. He's a business owner from Poughkeepsie, New York, up in the Northeast, and has participated in two studies, clinical trials, and both of them at Vanderbilt University. And he treats himself. He has self-treating opportunities through diet, exercise, and other ideas that he finds beneficial to him. So, John, we'd like to welcome you as well.
Thank you. Thank you. Glad to be here.
You're very welcome. And the last is Mike Bonner. Mike Bonner is a Midwesterner, a lifelong Midwesterner, and he's had several different jobs and careers on his way through life. He started out as a school and organizational psychologist for 15 years, then became a stay-at-home dad, supporting his wife and 2 children. He next became a learner, learned a number of skills that then allowed him to help manage family rental properties and conduct restoration and remodeling projects. And he has had to retire for, as you might guess, some reasons tied to the disease that he now has been diagnosed with. And so we're glad to have Mike with us as well. So Mike, welcome.
Thank you. Good to be here.
You're very welcome. So the way I think we'll start it is there are a number of you who are attending, and if any of you do have a question you'd like to ask, I have the Q&A box open right now. There's no questions, and I have one thing in chat right now. Let's look and see. Here's the one for a question. I guess we'll start with this until we get someone live, and so let me read this out, and we'll see who wants to go first. First question. Just curious if others have issues with their fingers like I do. For example, writing skills are abhorrent now, and scrolling and typing are becoming more and more difficult, progressively worse. My right hand pointer and pinky fingers constantly stick, with my thumb sticking underhand. So of the 3 of you, who would like to start this response? And then anybody wants to add on, please do.
Well, I could speak to that.
Okay.
I have problems with that. Over the past year, my hands have come to clench, as my feet do. They get very rigid, and it's very hard to move them. I can't type as well as I used to, and I used to be a very quick typist. I certainly can't write as well as I used to. My writing has become very small and slanted. I think they call it micronesia. So it's become increasingly difficult over the past year to deal with these dexterity issues.
John, Mike, anything to add?
Mike?
I definitely have problems with that. It's difficult to even write a check right now, sign my name. And that's one of the reasons I started seeing a problem that when I was working on properties, I found that fine motor tasks would give me problems. I'd drop a screw 8 times when before it would never happen. So I started that, that was a kind of an early symptom, and now it's gotten a lot worse. So writing is difficult. Yeah, definitely.
Just a follow-up question from my side of the coin. Have any of you tried occupational therapy, and has that helped when you did it? Did that give you some relief, or at least help you do some of the things that you might have briefly lost?
I have not, although I certainly need to, because I also have problems doing buttons, all fine motors, very difficult for me, opening cans, even my pillbox.
Okay. Yes. Okay.
I do occupational therapy. It helps, I think, maintain my skills that I do have.
Okay.
I don't know that they're ever going to come back, but it's certainly and they give me at-home exercises that I do to help too.
Okay.
So it's, yes, the occupational therapy is there as a maintenance. Try to stretch this out.
All right. Good. All right. John, you have anything to say or no?
I haven't had any dexterity problems. I'm starting year 6 now, and although my handwriting from day 1 has been almost illegible, it hasn't progressed since then. My handwriting is that of somebody who doesn't know how to write. I can't even sign my name, but I haven't had any dexterity problems yet.
Okay. That's good.
Yeah.
It kind of points to the snowflake nature of this disease in some ways, if you just listen to these 3 responses to that particular question. So thanks, John. Appreciate that.
Yeah.
The next question is one really is an example of one we really cannot answer, which is low dose naltrexone worth trying for anti-inflammation effects on microglial cells? That would be something that we would not be able to respond to from our own expertise. So I will pass on that one. There are opportunities if you would like. I see another question has come in. So let's go to this. This is from an anonymous attendee. How do you maintain a sense of positivity and resilience in the face of this condition? Can you talk about any treatments or therapy? Oh, well, let's go. Let's see, I've got 4 questions. So let's just start with the first one. How do you maintain a sense of positivity and resilience in the face of this condition?
That's a
John,
great
you seem to
question.
be one of the more, excuse me, I'm sorry, Mike. John was leaning forward. I was going to say, John, you
Yeah.
seem to be a pretty positive person. How do you maintain your positivity and resilience? What are some of the things that you might?
I was just going to say that we've all been dealt with this terrible disease, and although we don't have any cure or any options for treatment except treating our individual symptoms, I try not to think about the fact that this is a life-altering disease, and just I find myself halfway through the day sometimes saying to myself, "Oh yeah, I forgot I have MSA. It's going to be infecting my life." But so I would say to try and keep your life as normal as possible is what I do anyway. I start every day like that. Now it doesn't always happen that way, but it does, and it does start out that way.
It's a good way to start a day. Thank you, John.
Right.
Mike, you were going to say something. Yes, go ahead.
Well, it's a great question because it's one that I deal with every day. I feel like I have to be positive in the face of this disease. And so my strategy for that is to try to look for the blessings that have come with it. It sounds weird, but it's true that some of my relationships have changed because of this. Like my kids are more attentive, they're more supportive, and I also have the chance to it's sort of the 2-minute warning on life, I guess. Um, none of us ever know when life will end, but I've been given something of a warning that, hey, this is incurable, this is terminal, and so there's opportunity for me to get all my affairs in order and stay and do what I want to do. And um, so I try to look at it that way.
I thank you for that. It's a good response. Thinking about those other things besides how we face the daily life, but those in the future is an important part. So thanks for sharing. Kate, you have anything you want to share as well?
Positivity is difficult. It's something I struggle with because, of course, this disease can also affect your dopamine in your brain. It's very frustrating to lose function, to not be able to do what you used to do and used to do so quickly and without thinking. And now you have to pause, and that's a struggle. But I think I lead a life of distraction. I find other things to amuse me, to entertain me, to get involved in, and that certainly has helped.
Okay, very good. So you can tell it is a difficult proposition for a patient almost daily, and you've heard 3 different strategies that may help you if you're struggling with positivity and resiliency. Same person, I'll take 1 or 2 of these from her and then move on, or from the anonymous attendee and move on. One of the things, have you encountered any misconceptions or stigmas about MSA, and how have you addressed them? And then I'll just put that sort of with this next one. I think we can take care of both with 2 questions with 1 answer. What advice would you offer to others who are newly diagnosed or are supporting a loved one with MSA? So have you encountered misconceptions or stigmas? And then from that or from your life, what kind of advice would you offer those who are newly diagnosed? Who would like to start first? Kate, go ahead.
I've experienced stigmas about exercise, that if you only eat right and you exercise, you can perhaps rid yourself of MSA. There are stigmas about whether it's a disease where you simply lose your bowel function and your bladder function. It is not like that for all people. There are variations, as you said, the snowflake disease. And then there's, trying to be there for somebody that's been diagnosed. I think listening, they're going through a big transition in their life in accepting death. And, that's not something that people accept easily. And they think about all kinds of ramifications for their children, their families. So being sensitive to what they're going through, as well as the reverse, the patient, of course, being sensitive to family members as well for what they're going through and accepting that their loved one is going to die.
Very good. Thank you. Either of the others of you want to respond? Stigmas that you've met or any advice you'd like to share with someone? Go ahead, Mike.
I haven't met stigma. More common is nobody's heard of it. They don't know what it is, and so I find myself educating a lot, and that is what it is. It's a rare disease, and so, but for someone newly diagnosed, I remember that vividly. Let yourself be shocked and let yourself be sad about it, but then start figuring out how to assemble a team and how to exercise, get therapies for the symptoms, and fight this thing back as much as you can.
Good advice. Good advice. John, anything from you?
I think if you're newly diagnosed with MSA, so many things are coming at you at once that it's hard to understand everything. But what I did was I tried everything. I didn't vet things out that people said to me. I just tried them, and if it worked, then I stuck with it. If it didn't work, then I didn't stick with it. But it's not a disease that we know a lot of things about, so we can't really put a finger on what's going to work and what's going to not work. But there's so many different little things out there that people try, and you'd be surprised that things that make you feel good and things that make you feel that don't have any effect on it are really prevalent. And I would say to everybody that's newly diagnosed to try and find out as much as you can. It becomes a listening game where you have to really educate yourself and learn by everyone else that's around us. Because again, I never heard, up until 6 years ago, I didn't know what MSA was.
Right.
So,
And there's so many opportunities now as we progressed with the disease. You see YouTube videos produced by the coalition and by others. There's a YouTube channel by a patient. There's books now that are out. A lot of papers out that are about the disease, natural history study that John said he was in earlier, et cetera. So there's a lot that you can learn, and what John said, I think, is very important. Get to know the disease. So very nice answers from all three of you. How and when were each of you diagnosed with MSA? Let's go back to the beginning and give us a quick summary of how and when you were diagnosed with MSA. And Mike, we'll start with you first.
Oh, okay. I get to start this one. Well, the diagnosis happened over a series of years. I was having symptom problems with bladder, balance, strength. I was doing maintenance things that a year ago I was able to do by myself, but now I don't have the strength for it, or I was tripping more, I was stumbling more, or I was finding myself having these dizzy spells. I didn't understand them, and my general practitioner fortunately recognized it all fit together, and referred me to a neurologist who said, I think it's MSA, but I don't know anything about it, so I'm going to refer you to a specialist. So I got that news and had to sit on that for a couple months because that was in December. I used the MSA Coalition, researched, did everything I could. I even found a clinical trial and got evaluated for that before I was diagnosed definitively, which happened in May of this past year. And that's my journey. It took almost 6 months. Well,
Okay.
it was 6 months, 5 months plus December.
Okay.
Yep.
All right. Thank you, Mike. Kate, you're next going across to the right on my screen. So how about you? What was your journey?
I had symptoms for a number of years. I had the gamut of symptoms, tremor, lightheadedness. I would fall down. I was uncoordinated. I became very slow. I would lose my voice, or my voice would become whisper soft, and pain. I had extraordinary pain. My legs and the coat hanger would be considered the neck, and the shoulder back, a lot of rigidity. So I had a number of issues. I went to a doctor for CMT because there was CMT in our family. She thought these were CMT traits. I went to a physical therapist who actually diagnosed or thought that this looked more like Parkinson's. So I was scheduled to see a movement specialist, and the movement disorder specialist first diagnosed Parkinson's, and then Parkinson's plus, or atypical Parkinsonism. Finally, he diagnosed PSP, and I went for a second opinion, and then back to the first doctor, and lo and behold, MSA.
Okay. And that was in the last year or two? How long ago was that?
I've been diagnosed now for a year and a half.
A year and a half. Okay. So 6 months and a year, or yeah, it's about 6 months ago and a year and a half, it sounds like. John, how about your journey?
Okay, I was fortunate and unfortunately had some great doctors who were able to pinpoint this fairly quickly. As I said, about 6 years ago, I tend to owning your own business. In my office, I used to move pretty quickly, and I found myself bumping into walls every time I went around a corner. So I actually thought that it was that I was just getting older, and that maybe I was cheating death a little bit. And so I said I had the gamut of blood tests, and they thought it was Lyme disease. And I went to Yale, New Haven, in Connecticut, and the doctor said immediately he recognized the symptoms, and he said he rattled off 4 or 5 symptoms. I said, yeah, as a matter of fact, I happen to have those. And he said, you have MSA, and we'll do an MRI to confirm it. But they did that, and they saw that there was MSA present. So that's how it took place.
All right. And that was over about 5 years ago, 2019.
19, yeah. And I think it took about a month to diagnose it.
Okay. Very good. So you were quick. Once you got in, it was fairly fast in your case.
Yeah.
Sounds like. Yeah. Okay. I have another question here, and this is from Dave. I'm newly diagnosed. I'm an 81-year-old patient. I've always had a healthy lifestyle. I would appreciate any guidance on what to expect and suggestions on managing the disease. So each of you have a different timeline. And so let's take the longest timeline down to the shortest. So the longest would be you, John. So in general, what might be some things you would provide as advice to this 81-year-old person who needs to know what she might have to go through?
I would think, and what I've done and what I hope most people are doing is I don't let the disease beat me at this point. I just go on living my life as I normally would. I eat a little better, and I sleep a little better, and I exercise a little bit more. But I'm a firm believer in I think, Kate, you said it before, some regular exercise, a regular good diet, and regular good sleep. I noticed when I put those 3 things together, I have a good day the next day. If I am having a bad day, I think back, and in the last day or two, I probably didn't do one of those 3 things like I should have done. So I wouldn't let all of the things that you read, that you see, and that you hear dictate how you're going to live your life. I think you need to take control of this life, because this disease is a multitude of things. I don't think there's any single diagnosis that I've heard that is commonplace. So you can give into it, but I would suggest not giving into it.
All right. Now, the next timeline, 18 months ago, it sounded like, was Kate. So Kate, in your time from then to now, what are any ideas or suggestions you'd have for her?
I think I also try to eat well. I have my entire life. I've tried to be as healthy as possible, to exercise. I was very athletic through my entire life. Now I'm afraid this disease, at least in part, is controlling me. The symptoms come upon me, and I try to push through them, and I push. But unfortunately, sometimes I can't push enough, or I push too hard, and gets the best of me. So then I've got to ride with positivity again and figure out how I'm going to adjust myself to fulfill my bucket list, and be there for others as much as I can be for the term of my life.
Very good. Thank you, Kate. And Mike, you're the shortest of the bunch. So what would you say, since you're just beginning this journey?
Well, I would say that the two people that spoke before me had a lot of good insight. I think a combination of all that, you've got to accept it, and you've got to find a way to stay positive. You have to give yourself grace. This fatigue is a huge partner with you right now, so recognize that, push through it, exercise, but when you're tired, you're tired. You need to lay low. Recovering for 3 days because you work too hard on exercise one day doesn't help. So it's finding that balance that works for you.
Yeah.
Good.
That's my advice.
There you are. A balance that works for you is agreed to by everyone on the panel. So that's probably our best advice today. Okay, let's go to this. I didn't ask if any of you have orthostatic hypertension, but if you do, how do you manage orthostatic hypertension and its symptoms? So do any of you have that as a symptom? And if so, how do you manage it? Mike, I see you shaking your head. So you want to start?
Yes, I had it. I have it, I guess. That was one of the early pre-diagnosis symptoms that caused me the most trouble, or one of them. And I'm now taking fludrocortisone, and 1 dose in the morning, and it has, for me, worked miracles. So I rarely, if ever, now get that dizzy when I stand up, and my blood pressure is stable. It's still low, but it's stable. And yeah, so it's really not been a problem since I started on that.
Okay. Either the other two of you have orthostatic hypertension, Kate or John? What have you had to do?
I have it as well. You have to be very careful, of course, when you bend down for anything. Standing up is always an issue. My blood pressure falls dramatically, and I get very dizzy and nauseousness with the dizzy. So
Okay.
you can.
All right. Do either of you have blood pressure cuff at home so you can regularly check your blood pressure? Is that something both of you have
Yep.
as a tool? Yeah. Good. Okay, John, do you have it as well or no?
I do have it. I had much worse in the very beginning, like Mike. And I'm just sitting here thinking, I wonder if I manage it better, so that when I bend over and I feel that coming on, because you feel a wave of something coming on, you're not quite sure what it is. If I maybe stop, or I'm more cautious or more used to it, but I remember it gave me a bad problem in the very beginning, but it subsided somewhat. So that's good, or I manage it a little bit better.
One of the
Yeah.
two. That's good. I'm glad. It is a varying symptom for everyone. That's another one of those where it could be, just as John has said, one that seems to maybe over time decrease in its severity, and for others, there's more medication that's needed, or more therapies at home. So that's a very variable symptom for people. So these responses are probably typical for an MSA patient. Okay, the next one is from Candace. She says, thanks for doing this. So thank you all, from a patient. I'm newly diagnosed just 2 weeks ago, and the pain has been horrific. As muscles atrophy, they hurt significantly. Any tips for pain control? So I heard Kate say that she has horrific pain at times. What have you found to be a good way for you to handle pain?
I use a combination of baclofen, Lyrica, ibuprofen, and then duloxetine, which helps with depression, but is also helping a great deal with pain.
Okay,
but yeah.
And how were they prescribed, diagnosed through your movement disorder specialist, so someone might know where to go if they need to get some help with this?
I had a nerve conduction study done, which diagnosed that essentially the misfires in the nerves in the legs. So my legs feel constantly compressed. So I would recommend, yes, going to a movement disorder specialist to try to control that pain because it can be very, very difficult.
Okay. Do either of the other two of you have pain as one of your symptoms, Mike or John? Either of you?
Mike?
No.
Okay, John. Yeah, I do. Leg pain and as Kate said, the coat hanger effect, neck and shoulders. I deal with it a couple of ways. Believe it or not, the leg pain gets better with exercise. So I try to do a lot of exercise. If I do too much, the leg pain come back. So again, it's about striking that balance. Coat hanger effect, actually, that has helped the most is some posture exercises that my OT gave me to do. When I do those regularly, I feel better in the neck and shoulders, and my posture is in fact better. I don't have that slumped over, head down kind of droopy look. And then over the counter pain stuff occasionally. That's how I approach it.
Okay.
Back to you, John.
Okay,
Yeah,
thank you, Mike. I agree that the over-the-counter method that Kate and Mike both mentioned is effective, but also I've been very fortunate to find that exercise and stretching that particular area is beneficial to when those muscles start to ache or they start to atrophy a little bit. I've been lucky to find that stretching those areas, especially my calves and my legs, and that's been effective for me. When all else fails, I take 4 or 5 Advil.
Okay. How many of you have had physical therapy previously, and has physical therapy helped you? Okay, Mike, did it help you when you had physical therapy?
Yes, I'm still
Okay.
actively involved in physical therapy, and it helps a lot with balance. It helps a lot with strength. It helps a lot with the muscle pain, as I said. I highly recommend it.
Okay. Kate, same with you, or what have you found?
Therapy has mostly helped me be more conscious of my movement, so that I can be more coordinated. You know, when I walk, for example, I
Okay.
don't move my arm because of the disease, but it helps me to be conscious enough to try
Okay.
and make my life. So physical therapy has been great in that respect.
Okay. Very good. So let's go to the next one. Now, this one is for Kate. Why did they finally change the diagnosis from Parkinson's to MSA? In your disease progression, was there extra symptoms apparently the person wants to know? Was there something that pointed from Parkinson's to MSA?
I can take that.
No, you're the one for you, Kate.
Oh, it is for me. I'm sorry.
It's specifically for you.
Okay. So I had a synuclein test, which came out abnormal. And I had an MRI, which showed white matter in the brain. And I had the nerve conduction studies. So I had a myriad of tests, and in combination, the symptoms that I had painted a picture that was more Parkinson plus, and then MSA, because of the Parkinson, the rigidity of my movement and the tremors, and than anything else, than straight Parkinson.
Okay, so thank you. I hope that helped you. If it's something that you're going through as well. Let's see. Let's go to another anonymous attendee. The diagnostic journey is hard, and it certainly takes self-advocacy with healthcare professionals. What advice would you give those to others who are experiencing difficulties getting to the right diagnosis? What worked or didn't work for you all? And I heard, I know Kate has told us about her journey, and Mike a bit, John as well, but how did you move through the healthcare system at that time? I know each person's different, but are there some general rules that you found helped you get through that point from I've got symptoms, my GP is saying this or that, and now suddenly you have MSA? Is there anything that you could help maybe get us on that journey or get us through that journey? Who'd like to answer first?
Okay, I'll take step this.
Okay.
I'm finding that with the different doctors, we see so many different doctors because there's so many parts of your body and so many things that this affects, that they all want to first of all, you're going to be fortunate to find somebody who knows about MSA. So when you go to that specialist in another field, whether it's a gastrologist or some internal medicine or muscle disorders, you can hope that they understand the MSA, but you just can't let them say, well, it's the MSA and that's the end of it. Because I found that in the very beginning, that's what the different doctors were, just always go back to finding that MSA is incurable, or they don't know a lot about it, or not many people have it. And I started advocating for myself, saying that's not acceptable to find that out. I want you to learn about MSA, or I'll tell you about MSA, or I've actually sent them pages of information that to their office so that they could understand what MSA is and they can understand what my different dilemmas might be. So I think that whatever ails you, if you're newly diagnosed with MSA, don't let the doctors fall back on that easy way out and just saying, well, it's MSA, it must be problematic. So I would fight for a better diagnosis.
Very good advice, John. Very good. Anything from the other two of you that you'd like to share with them?
I would say that, to give perspective to what was just stated, there are 600 doctors in the country that know anything about MSA. When you consider that big hospitals like Mayo have up to 7,000 doctors on staff, you look at 600 doctors across the country who know anything about MSA, and it really gives you some perspective. I've had a hard time actually with the advocacy part. Where I was diagnosed, I had a great team of doctors. I then moved across the country, found insurance was an issue because I had a terminal diagnosis, couldn't get a doctor that would see me for 18 months, which when you're talking about MSA is a big deal. It's like going to an OB and being told you can't be seen for a year. So I've had a very difficult time advocating for my particular needs and treatment.
Very good. Yes. Well said. Mike, anything from you? You're just beginning the journey. What about your?
I'm just beginning. My answer is some combination of those two. I was given, like I said, the probable diagnosis without any understanding of it at all. And the neurologist even admitted he didn't know. That's why he's going to make a referral. The referral's 6 months out. And I thought, that's way too long. I'm not waiting around for that if I have this thing. So I started doing research, and I found clinics, and I applied, and I found clinical studies, and I applied. I just took matters into my own hands, so to speak. And I would suggest doing that as well. When you run up with a roadblock with a medical professional or therapist, I've switched PT, I've switched OT. If it's not working, if they don't understand it and they refuse to get educated, nobody's going to know about this, so it's okay. But if they don't at least be willing to get educated about it and be open, it's time to move on.
That's very good advice from all three of these people. If you were listening, it's very good to be the advocate. And as John said, share information. As Mike said, if they don't want to, maybe it's time to move to someone else. And as Kate said, it's the advocacy, having doctors listen to you when you sit down. That oftentimes does not happen in the healthcare system we have. So good advice from all three. See, what's the next one? Okay, let's go down through one quick one. This would be a yes or no. Have any of the three of you had the skin biopsy test to maybe confirm or to say whether you have MSA or not? Okay, Mike says no. Kate, have you had it? The skin
Yes.
biopsy test? Yes. Okay, and did it come back MSA?
It came back abnormal, indicating MSA.
Okay, and John, have you had the skin
I've
biopsy?
had the test, although they didn't test for MSA. It was part of that natural history study
Okay.
that they took the information.
Okay, so you've had it as well. So 2 of the 3 have had the skin biopsy test. Now, the next one is what of the 2 types or 3 types, I guess, if we take atypical Parkinsonism as one, which of you have MSA cerebellar? Do any of you have MSA cerebellar or have been diagnosed with MSA cerebellar? Mike
I-
has, okay. And John, okay. How about MSA Parkinson's?
That would be me.
Is that you, Kate?
It is me, although there is some overlap of symptoms. But yes, I'm a P, Parkinsonism.
Okay, so we got 2 with MSA cerebellar, 1 with MSA Parkinson's with some overlap. So that'll answer that one. And then here's another one. I guess this would feel you've started it, so let's finish this process. How do you communicate with your healthcare team about the symptoms and treatment preferences so that you get the care that's aligned with your needs and goals? All 3 of you said that that's something that's important to you. You try your best. I guess John answered this by saying he shoots out information through papers or articles or whatever to get information to the healthcare team. Do any of the others do the same, or are there other additional steps that you might take to let someone know what MSA is and how to treat you?
No, I might be the outlier here, having taken care of other people with terminal diseases that are not MSA. And I would say it's very important to have somebody, if you can, some person in your life that advocates for you. Because when you're a patient, what you hear is not always, it's tainted by your fears and a lot of things that are going through your mind. To have somebody that actually tracks the information for you and is able to speak on your behalf, particularly when I lose my voice or I cannot write, to be my communicator is extremely.
Okay, very well said. Good. Any other? I know, John, you've already pretty much answered the question. I think, Mike, you did as well. It's basically keeping them informed and making sure that if they aren't informed, that you can move on to someone else and there might be someone else available. That'd be a pretty good assumption, Mike, from what you suggested earlier.
Yeah, definitely. I report weekly to my physical therapist and occupational therapist about how things are going. They keep good notes. They are open to sharing with my neurologist. We're here now getting sort of a checkup, if you will, in all the areas so they can start giving a treatment plan back home for us to implement again. So we're just getting started on all this stuff, but communication is huge, huge. And again, you have to sometimes just take charge of that because the system isn't, it's not natural to them.
No, that's well said. Very well said. Question: how has this impacted your family or your spouse?
She's right here. Do you want me to put her on?
Well, what do you think? No, how has it impacted the spouse or family? If you know, either one, that however you'd like to answer it. But what would you say? Has it been a positive, a negative? Has it been an issue? How would you respond?
Well, I'd say okay, go ahead, please.
Go ahead, Kate, please.
Go ahead, Kate, first.
I have what I identify as 3 families. They're my children, the family I grew up in, and friends who I have made family over the years. I would say that for my children, I have kept a profile on what's happening. I've needed to do that. For my family I grew up in, I think they've been somewhat in denial. And so it's been very difficult to share how I feel about this disease or what's happening. So my circle of friends has been those that I rely on to help me get through. Sometimes you take a day at a time. Sometimes you take it a moment at a time. Those are the ones I've needed to turn to.
That's a nice way to look at it. Very well said. Mike, you want to go next?
Sure. I with my kids, they both were in college when I was diagnosed, so they're adult children now. They've responded wonderfully. Of course, they're saddened by it, but they are my biggest encouragers for therapy, or when I get down, they keep me going. And my wife has been a huge support. Unfortunately, a lot falls on her now that didn't used to. She has to pick up a lot of slack, and she helps me in a ton of ways. So I have to be mindful of that and try to be supportive back in any way I can. My extended family's been great, so it's just a matter of, I mean, it changes everything in terms of your knowledge about, okay, this person has limited time and we're going to start seeing less and less of them. And fortunately, everybody stayed pretty positive and tried to appreciate what we have right at the moment and not look too far ahead.
Thanks, Mike. John, how about you?
I think this is somewhat of a loaded question because, of course, your family and your friends are going to come to your aid and come to your side and be supportive, but they don't want to hear somebody who complains about MSA or complains that they have MSA. I can't remember once that I've led with that statement saying that I have MSA, so you need to be more cognizant of that. I think the less we talk about it as patients, the more you're going to find support from your family and your friends and anyone for that matter. So I would just be humble and you know, we have this disease, we might as well deal with it. There's no sense making a spectacle of ourselves, you know?
Okay. Good. Thank you. Thank you, all three of you. I guess, let's see. I have two that are kind of together, both from an anonymous attendee. So the first one, sleepiness. Do you feel, and over the time that you've had this disease, do you find yourself progressively getting sleepy, or is it something that's a hit or miss with you? And then to go along with that, do you experience any gastrointestinal issues, and how have you had to address them? So I guess sleep is one. Do you find yourself progressively sleepy, or does it seem to occur based upon what happens on a day or on a particular event? And then the second, do you seem to have any gastrointestinal issues, and how do you deal with them? So who would like to start?
I'll go ahead and start because these are both issues that I'm dealing with now. And in the very beginning, I'd say about the second year, the first and second year, I had some sleep problems where, you know, I wasn't sleeping at night. I don't think it was attributed to the fact that, you know, my mind was racing with the fact that I have this disease, because I had trouble sleeping before, about 4 hours. I'm finding now that as things progress, I don't know if it's a condition of MSA or not, but I'm finding that I'm sleeping twice as long. I'm sleeping about 7 hours. But what I do sense is that I fall asleep and sleep throughout the night, but I wake up totally exhausted, like I haven't slept at all. And so I don't know if that's my mind playing tricks on me or not, but it's been about 6 months that I've noticed this happening. So that's my response to the sleep question. The gastrointestinal, about a year ago, I've noticed that things are slowing down. My appetite is decreased tremendously. The amount I eat and I drink, and I've had every gastro test that they have out there, and they really just throw up their hands and say, we don't really know what it is. And I can only attribute it to that my whole metabolism is slowing down. I'm getting a little older too, so we have to deal with that. We don't really know what's playing a factor in that, but the doctors are saying that they can't find anything wrong, so I can only attribute it to MSA. As a result of that, I have a lot more acid reflux than I've ever had in my life. I gained a little bit of weight. I don't eat as much, and I'm not as regular in the bathroom as I used to be. So all those things, your gastro is going to be affected at some point. I'm finding anyway.
All right, thank you. Kate, anything from your to add to that?
Yeah, my gastrointestinal tract is not affected pretty much at all. But insomnia is a constant problem for me. I think it's the blinking of the eyes. I don't get into REM sleep. My eyes get dry. I act out my dreams, so I can wake up in the middle of the night screaming, and then I'm up generally every hour if I'm lucky enough to sleep for an hour at a time. So that has been a progressively declining issue for me.
Right, so another one. And Mike, how about you?
Some combination of those. My sleep is generally good, except I do have bouts of difficulty falling asleep, and if I wake up early for the bathroom, sometimes I cannot get back to sleep. I'm tired a lot. Fatigue is an issue constantly, and that leads me to longer sleep when I do get good sleep, or maybe a nap. Gastrointestinal is always been an issue, but it's becoming more of an issue, and it's one of the things we're trying to sort out right now in terms of how to symptom manage it. It's not fun and it's not easy, but we'll figure it out.
Good.
Do you guys take anything for sleeping? Any guys sleeping aid or anything?
I don't yet. I've been told to take melatonin. So.
Right.
Okay.
Kate?
I do. I take clonazepam, a very low dose. I've been told, I guess, trazodone is better. I try not to take anything if I can, but there are times that you just you need to.
Yeah,
absolutely.
I found good luck with magnesium later in the day, taking a couple of tablets of those supplements, and when all else fails, because the grogginess that you feel from the Advil PM or Tylenol PM or the prescribed medicines that you talked about, I find that some form of CBD that you can find from your local shop, or if you happen to be in a state where THC is available, I've been experimenting a little bit with that in low doses as well, and it's been very effective.
And there are some movement disorder specialists that will diagnose or will prescribe one going to, if they are in a state where that is legal, to go and get as a proper medication to help in some of those, either of those symptoms.
Right.
So glad you brought that up. Kate, were you going to say something too? You sound like you were.
No, thank you.
Okay, you're welcome. All right, so let's see, we're getting close to the end, so we've got probably a couple of that we can answer. How are you feeling now about your current treatment? Do you feel the medical professionals are doing everything they can for you? I think you answered this pretty well, but if you were to summarize it, your treatment team, all that's around you right now to help you through this, how do you feel about it? John, how do you feel?
I think the doctors, the real specialists in MSA, they really don't have any solution to this problem, because there are no medications and there is no cure. So their hands are kind of tied. I think that you have to be your own advocate for going out and trying things. Like I said at the very beginning, try as many things as you hear about, and then decide for yourself what works and what doesn't work.
Okay. Kate, how about your healthcare team? Do you find it working well together? Is it a team with you?
I think I need to search out. I'll be moving soon, so I'll have another team soon, but some of the medicines that I've been on, I think you slowly, they become less effective over time.
Right.
And so it's important to keep on top of that, as it's also important to keep on top of whether or not you're experiencing an MSA symptom or a side effect or something altogether different having to do with age, etc.
Very important. Very important. Mike, how about you?
Um,
Your
I
healthcare team working well together?
They are. I feel very blessed. It's taken a while to put this together. I've had to switch providers, uh, not frequently, but often. And I just would say that, again, the combination of seeking out the right professional who knows about it or is willing to learn about it, and like John said, take your own advocacy, figure out things that work for you. Try things on your own, but when you do, at least for me, when I report that back to my medical professional, things tend to work better. Than I've got the kind that will defer, say, "Oh, okay, glad you found that, great," and I don't want to hear the doctor say, "No, that's not something that I would prescribe. Forget it."
Good. Okay. It's about 4 minutes before it closes, and there are a couple of questions here that are related to a person's health. But I do have one question I think that might take us up to the time, and it's probably pretty important given what John brought up or what we brought up in John's bio and what the other two of you might be even trying now. And that is, are any of you enrolled in a clinical trial? And then I just go ahead with that. What was your experience, or what has been your experience in being in that clinical trial? So I'll go to any one of the three of you, and let's see how and what you've been able to experience. John, since we already know a bit about you being in a clinical trial, what did you find, and how did you feel about that process?
Well, unfortunately, I'm not going to bring a lot to the table when it comes to this, because what you find out in a clinical trial is that they don't tell you a lot of information about what's happening or what's going on with you. They take that information and they're trying to create a drug that works for MSA. So they're not going to put words in your mouth or ideas in your mouth or in your head. They just want some feedback from you, and you don't get really any kind of feedback back. I am in the Dexterity study now, and that finishes in about 3 months. I really don't know, because like I said, they don't tell you a lot. So, people ask me all the time, is there any effect that you're in that trial? And I say, well, I don't really feel anything. I can't say when I take that pill, but I don't know if I'd be any worse if I weren't taking it. So it's kind of a double-edged sword where you really don't know.
That's very true. Yes, they're not allowed to tell. I mean, that would take
Exactly.
the study. So it's very important that they don't show their biases when they talk to you.
Right.
Kate or Mike, are either of you in a clinical trial right now, or have you tried to get into one yet?
I
I'm
am.
not.
I think I'm in the same one John is in. Dexterity one right now. Mine ends in April next month.
Okay.
I was actually enrolled in it before I got the diagnosis confirmed. I think for me, although you're right, John, you don't get any information because it's just a research study. So they're collecting data, but not giving you data, because the data doesn't mean anything without mine being put together with John's, being put together with the other subject, et cetera, et cetera. That's all well and good, but what it does give us is the idea of hope that maybe I'm getting a drug that's going to help one day. Maybe I'm getting a dose that's right. And so, I've tried to find, going back to positivity in the first question, any opportunity I have to be hopeful is a good thing. So being involved in clinical trials is okay by me.
Well said. Kate, how about you?
I'm not. I have many friends who've had mixed experiences with them. I do think it's important to try and help find a cure for MSA, and this is the only way to do it. So I will search out those that I can participate in. But they come with challenges, as was stated.
Yes, they do. There's a lot of challenges. And as
Yeah.
Mike, I think, said, the most important thing is they do give hope. You must remember that even as late as 10 years ago, there were no trials that are at the point where John and Mike are right now, others and I think Kate's brought up a good point. If you want to participate in a clinical trial, just want to point out to you that on the MSA Coalition website, there's a whole section set up to help you learn more about clinical trials and even link you up with them. And you can always go to www.clinicaltrials.gov, put in the disease, look for a treatment, and you might find one. And I think it's time to end, and I'd like to end on this hopeful note, is that yes, there are now opportunities to treat this disease if indeed these clinical trials provide some positive impact. And so I'm glad we have two of the three that are participating, and Kate wants to participate, and Kate may very well be able to get into one shortly. And hope all of you who have attended today are also able to participate someday in a clinical trial. And we also would like to thank you for joining us. I hope the answers from, and I'll start on my left, Mike Bonner, a Midwesterner who's helped us today with his answers as the latest to be diagnosed. We have Kate Altavarius, and Kate has been diagnosed for about 18 months, and we appreciate very much, Kate, you joining us and sharing your perspective and what you've been going through. And the one that's been diagnosed the longest, John Urban, has been with us and has provided some very good insights from what he's gone through. I'd also like to thank Maddie Adams and Casey Coletti, who have helped us by being at the board and getting the questions to us. And I want to thank the MSA Coalition for sponsoring this, and hopefully it has been a help for all of you who have attended. And I think we now have three people who know each other a little bit better, and who knows, maybe in the future, Mike, Kate, and John will be meeting each other in some other time. And again, my name's Larry Kellerman. And a former caregiver of a wife who passed away from MSA cerebellar, and I'm always glad to be able to step forward and help. So thank you all for attending. Casey and Maddie, you have anything more you need to say before we close?
No, we do not. Thank you so much, everyone.
All righty, so thanks a lot. You all have a good Monday and a good rest of the week, and talk to you again soon. Bye-bye. Bye, Mike. Bye,
Hey, thanks,
Kate.
Barry. Bye.
Bye, John. You're very welcome. Thanks for joining us. Appreciate it.